introduce Professor Daniel Stran from Uruguay. Dr. Stran is a medical doctor and a specialist in orthopedic manual medicine, and a member of the Barcelona group of the orthopedic manual medicine, and actually a member of SEMIO and the president of the Latin American Society of Manual and Orthopedic Medicine.
Thank you for your presentation.
We will be very happy to hear about the soft tissue dysfunction as the main cause of pain in manual medicine.
Dear colleagues, my name is Daniel Stran, and it is my pleasure to greet you from Montevideo and Uruguay. I would like to thank the official of the International Federation of Manual Medicine for this opportunity, and also my colleagues of the Spanish Society of Orthopedic and Manual Medicine, SEMOIM, for the trust they have had in me. Manual orthopedics medicine is defined as the medical discipline that studies the diagnosis and treatment of musculoskeletal pains, which are functional and benign. They are the most common complaint in our daily practice. This definition does not include the surgical aspects of the musculoskeletal system, which belong to the fields of orthopedic surgery and traumatology. We also exclude inflammatory disease, which affects the immune system and are part of the area of rheumatology, or the tumor process in the field of oncology. The treatment of the pain that we mentioned before is performed by manual or other minimally invasive techniques. But then, which is the principal cause of pain in our patients? In order to understand it, let's firstly analyze the area of physiopathology based on the study of painful minor intervertebral dysfunction by Professor Dr. Robert Main. Henceforth, we will refer to this dysfunction as PMID. The process implies an interruption of the intervertebral dysfunction. This is due to an increased level of tension. This tension is, in turn, transmitted to the posterior side of the vertebral column. This results in the blocking of the one of the intertransverse joints. What is the most relevant consequence of this problem? It will be the inflammation and irritation of the brachial nerve and its repercussion on the soft tissue. The key to understanding this clinical condition lies precisely in the compromise of the spinal nerve. The patient presents a neurogenic inflammation of the soft tissue in the area of action of the compromised spinal nerve. The irritation of the nerve provokes an increase of the tension on the soft tissue, which is the consequent inflammation. This inflammation becomes chronic, which implies the onset of fibrosis with adhesions. Excuse me. The level of the subcutaneous tenous cell in area of suspended cellulitis appears detected by the classical maneuver described by Professor Dr. Robert Main as the rolling pinch or pince roulé in its French denomination, which identifies the PMID. In this maneuver, we leave the skin, then compress, we pinch it, and then we move it like rolling in the direction of the heart. The characteristic tight muscle band appears in specific mechanical action areas, which are points that we may call exquisitely algid. This is the trigger point. This muscular process of neurogenic cause is especially important at the level of the multifidus paravertebral muscle, in close relation with PMID. We would like to throw into relief that this muscular process is the capital pathogenic phenomenon that causes pain in a PMID. The increase of the muscular tone maintains the articular blockage and the irritation of the nerve. On the contrary, the recovery of the muscular tone in the multifidus turns out to be the most important aspect in the functional rehabilitation of PMID and the pain disappearance. Proof of this is that it is not always necessary to apply vertebral manipulation in order to fix the problem. However, it is always necessary to perform a suitable treatment of the affected muscular tissue. Furthermore, the vertebral manipulation itself acts thoroughly by inhibitory stimulation of the mechanoreceptors of the area, more than by pure mechanical effects. Evidence of that is that the efficacy of the vertebral manipulation depends more on the correct tension applied and on the execution of the maneuver in the right direction than on the force of the impulse. Such is the concept already exposed by Professor Dr. George Berlinson. In fact, nowadays, our manipulative techniques are implied as suitable treatment of the mechanoreceptors. Which technique? Congratulations is very important. Is very important. Which technique can normalize the muscular tone in the affected segment? The manual technique must have a locking of action in accordance with physiopathology. Therefore, it will be useful to perform a maneuver which eliminates that underside muscular tension, acting at the level of the mechanoreceptors. The drag and resolution technique is a personal method based on Raymond Nemo's receptor tonus technique. We must remember Dr. Nemo as an outstanding academic theoretician of Palmer College in the USA. The drag and resolution technique addresses the pathology with a dual mechanism of action. Direct effect, it applies as a landing pressure of the fascia which covers the junction of the tendon with the muscle, such as action, cause or release of the restricted fibrosis of the region. Consequently, it helps both to relieve the patient pain and improves their ability to move. Second, indirect effects. In the trigger point, the pressure is maintained and they become inhibitory pressure with an inhibitory effect on pain due to an afferent stimulus to the nervous system. This is an extremely relevant effect in the tone muscular mechanoreceptor area, Golgi tendinous organ. This technique is useful both for identifying PMID and for reversing it.
The application of the drag and resolution technique on the lumbosacral region. The doctor uses his elbow. He performs sliding pressure over the sacroiliac joint and sacral-iliac crest, where the mechanoreceptors and Golgi's tendinous organs are. Now, the technique is performed on the paravertebral region, multifidus zone, cranial direction. Where tight bands are found, the maneuver stops and the inhibitory pressure is applied. The elbow is comfortable for the doctor while working and efficient for the patient.
Okay. And now we are going to show the specific technique of muscular action. Therapeutic chiromassage, and especially the stretching massage technique of Jordi Sagrera Ferrandis, with beneficial action for recovering the muscular tone and the affected muscles length. It is about as landing pressure will the muscle remain stretched, acting on another mechanoreceptor, the neuromuscular spindle. Myotensive technique, particularly Mitchell's technique. Now it is adequate to use the action of agonist and antagonist muscle of the affected vertebral segment. The contraction of the antagonist is stimulated while the doctor exerts a force of resistance of the same intensity and in opposite direction. The doctor constantly controls the articular position and the muscular force, always observing the due protocol of the technique. In this way, the agonist muscle gets relaxed, thus gaining articular amplitude. This may make it possible to revert PMID. Thus, the technique acts on mechanoreceptors, adjusting the neuromuscular spindle and inhibiting Golgi organs. In many cases, these techniques are enough to unlock the articulation and revert the PMID. If necessary and appropriate, a vertebral manipulation will be applied, which will be more efficient and longer lasting after having previously treated the soft tissue. Summarizing, the PMID in the vertebral spine is maintained by an imbalance of the mechanoreceptors and their muscular effects. This is the principal problem and the cause of pain. Therefore, the soft tissue treatment should be the principal target of the specialist in manual orthopedic medicine. A random sample of 100 patients for my private patients, 20% of the patient improved with the only application of soft tissue technique. Thank you very much. Thank you for your attention.
Thank you, Dr. Stran.
Thank you.
Thank you, Dr. Stran. One question, if we may ask, why do you think that inhibitory pressure is more effective in the than the drag and resolution technique?
Because the drag and resolution technique eliminates the fibrosis that maintain the existence of the trigger points.
Is it important to maintain order when using different soft tissue technique?
Yes, it's important. It's very important to follow those protocols because each technique works on different mechanoreceptors.
Thank you very much. It was very interesting. Thank you.
Thank you. Thank you for your
We
attention.
will